Hi, everybody. It's time for another bi-weekly update about the COVID situation around the world and the nation and the state of California and around our area here. So I will start sharing my screen with everyone again. And this is kind of the overall summary that we have the same type of hotspots that we've had before. Cuba, Iran, Malaysia, Mongolia, and Botswana are all still hotspots as they were 2 weeks ago. Here in the US, there is a persistent rise in cases as there is in California, and this is seen in hospitalizations as well. Our vaccination rate is getting a little bit better at 0.86 million in the US, and 66% of Californians are currently fully vaccinated, which is getting better. And unfortunately, mortality is now increasing in US and California. So let's start from the top as far as vaccination goes. If you can see here, the US has fallen again a couple more spots, and China has actually risen to just above the US as far as the share of the population fully vaccinated against COVID-19. And I want you to pay attention to two countries, Chile and Israel. You can see both of them have very good, very high vaccination rates, and we'll touch back on them in a little while. Here you can see that 171 million people in the US are fully vaccinated. And overall, we're doing a little bit better over the age of 12. Over 60% of the population is now vaccinated. And over the age of 65, 81.2% of the population is vaccinated, which is better. You can see that as far as administered doses per day, we're at 0.86 million. That's still a far cry from our peak vaccination rate back in April, but a slow, steady type of rise. Here you can see that this somewhat tepid rise in vaccination rate has contributed to us sliding back a little bit as far as the projection of when 100% of the US population is going to be fully vaccinated. It was earlier in March, 2 weeks ago, but now it's pushed back to March 31st at 90% of the population being vaccinated next year. Here you can see the percent of each state that is fully vaccinated. And this is very similar to what the map looked like 2 weeks ago. One bright spot is that Arkansas and Louisiana are finally increasing their vaccination rates a little bit. But otherwise, these other states that remain quite pale on the map have not significantly changed their rate of vaccination. Here in California, we're administering 95,000 doses per day on average, and again, a slow, steady rise there. And here you can see that of the over age 12 group, we are doing a little bit better than the national average at 65.5%. But unfortunately, in the age over 65, we are lagging behind. We only have 71.4% of that highly vulnerable patient population vaccinated. You can see here in Santa Clara County that 82.4% of the population over the age of 16 and even 80.9% over the age of 12, which is great, which means that we're getting more of our kids vaccinated now that that has been given emergency use authorization. Here you can see, again, the age over 65, and this is just to show you that although California is lagging the US, Santa Clara County is actually in lockstep with the US as far as how much of that population is vaccinated. As far as global cases, you can see that we've added about 10 million cases over the last 2 weeks, but thankfully that has only equated to about an increase in 100,000 deaths over the same period of time. And that's because case fatality rates, you can see overall, have been holding quite steady. When you see that the worldwide new cases per day, there is a 2% drop in the overall new cases per day across the world in the last 2 weeks, which may be a positive sign. Here are the hotspots, same hotspots as before, really. The US, Mongolia, Malaysia, Botswana, the Middle East, and parts of Western Europe are all quite bright still. When you compare the US to the European Union, unfortunately, the US continues to rise in this steep curve, whereas the European Union has really done quite a good job at turning their line back around, and they're starting to move down now. When you look overall at the selected countries with a rising case rate compared with us, again, I want you to pay attention to Israel here, which is kind of having this skyrocketing, shooting up curve, really no end in sight to their case rate. And compare that to Chile, which had a high curve a little while ago in June and now is quite low, down to where India was. And when you look at the vaccination rates between Israel and Chile, it's quite similar. So something is going on, and we should pay a little bit of attention to why Israel continues to have these climbing case rates in spite of having quite a good vaccination rate, and in spite of even having part of their population getting third dose boosters at this point. One other area to notice is the UK had a steep rise, then they came down, but unfortunately they are again rising up now around where we are again. When you look at national cases, unfortunately, we do have a persistent rise here in the US, the 7-day average at 151,000 approximately. And here, the sort of much wider spread of these hotspots across the US national map. And I think this is a perfect example of how, when we started looking at this about a month and a half ago, it was really concentrated to Missouri and Arkansas. But in spite of having a really nice pale yellow map across the United States otherwise, now you can see that that spread is just going to be inevitable unless we get a larger proportion of our population vaccinated, and variants can no longer arise. Here you can see that there is, most of our states are still rising, but some have a turn down from their peak. So in particular, Missouri and Arkansas, where this latest surge of the pandemic first started, they have turned down a bit, as well as in other areas like Iowa and Kansas and Texas, Rhode Island and Maine. As far as cases in California go, you can see that there is this persistent increase in cases here. And in Santa Clara County, unfortunately, there's also a persistent rise in our cases. And you can see now we have surpassed our prior July surge, although we have not come near our winter surge from before. Same thing in San Mateo County. We have surpassed the July surge numbers, but nowhere near what our midwinter numbers were. As far as Stanford, we're doing pretty well. A cumulative 274 cases within the students, and just 8 last week, with 26 in the last month. As far as the faculty, postdocs, and staff, we're doing pretty well, 239, but more in the last month, 43 in the last month, and 14 in the last week. When we look at variants, you can see the Delta variant has really taken over completely all the other variants. It's over 98%, and in some sites, it looks like over 99% of the cases in the United States. As far as California, you can see the share, that's Alpha, Delta, and the Delta Plus variants. And you can see that it's almost all Delta and Delta Plus at this point. Only 2% is still the Alpha variants, and even lower percentages of any other type of variant. There hasn't been any change as far as the variants of concern versus variants of interest as far as the WHO is concerned, the World Health Organization. But there is a lot of talk in the media. If you remember from my last report, we were talking about the Lambda variant and how it was the highest variance of cases in Peru, which has the highest mortality rate, but that was for a lot of different reasons. And this is just in the last week, a headline from the Los Angeles Times. And I wanted to just break down for you guys, there are 152 cases of the Lambda variant in California. 88 of those cases first actually appeared in April, which was similar timing to when the Delta variant first appeared. And therefore, it does not really look like the Lambda variant is outperforming the Delta variant, meaning it's not looking like it's more contagious or that it's more transmissible, because we would expect to see more numbers if that were the case. And so certainly something to keep an eye on, but nothing to be too concerned about right now. As far as which variants are in Santa Clara County, you can see that we do have the Delta Plus variant in certain numbers, 73 of the AY.1, 4 of the AY.2, and 8 of the AY.3. And then we do have 5 Lambda variant cases, which is new in the last 2 weeks. As far as hospitalizations go, you can see, unfortunately, there's also a persistent rise in this. And interestingly, when you look at the cases in the UK, they reached 80% of the winter peak this summer, but their deaths and hospitalizations only rose modestly in comparison. But when you look at the United States, unfortunately, hospitalizations and deaths are rising more quickly, and that likely has to do with a reflection of our vaccination rates, the timing of our vaccinations, and things like that. When you look at the pediatric cases, which many people are much more concerned about recently, you can see that in the last 2 weeks, children represented 22.4% of all COVID cases. That is definitely up from the overall percentage across the entire pandemic. Children have made up about 14.6% of all cases. So there is an increase in the last 2 weeks, about 7% increase in the cumulative number of child cases. You can see that overall, when you look at hospitalizations, it's still a very low number of children that are hospitalized, 0.2 to 1.9% of all child COVID-19 cases getting hospitalized, and an even lower number of deaths. So just 0.00 to 0.03% of COVID-19 cases in children resulted in death. So perhaps not the most concerning, but definitely an uptick in pediatric cases. As far as hospitalizations in California, you can see there's just this steady rise overall. And then as far as Santa Clara County, also increasing. Our hospitalization as of 2 days ago was 245 beds with 69 ICU beds. And then in San Mateo, a pretty low COVID census overall, but a slight rise as well. When you look at San Francisco, unfortunately, this is persistently increasing, and we're at 112 beds as of 8/20, and 39 ICU beds being taken up because of this. Overall in the Bay Area, of course, there's also a persistent rise, and you can see we added 217 cases in the last 2 weeks. As far as mortality goes nationally, unfortunately, deaths are climbing as we would expect with the recent rise in hospitalizations. Although we're much better at treating this disease, a certain number of patients who are hospitalized will certainly not make it. And if there's a higher number hospitalized, then that overall mortality rate will go up as well. And then as far as in California, there is also a slight increase. 72 deaths is the last 7-day average. And then as far as Santa Clara goes, overall, we're not doing so badly, but 10 deaths over the last 2 weeks. So I hope that that was all helpful for everybody. And I hope that it helps you make decisions about you and your family and your friends. And I will be back in 2 weeks.